Hi, my name's Jill Ellerton, and I am currently acting Principal Occupational Therapist for North Yorkshire County Council in Adult Social Care. We've been asked to do this video as part of a resource pack for people who want to know a little bit more about occupational therapy. And so there's a few questions that I just thought, well, I will try and answer for you. I've been qualified as an occupational therapist for 19 years, and I began my journey as an occupational therapist when I qualified in 2003 at Teesside University. Prior to that, I had done another degree course to enable me to progress because I didn't get the points at A-level to enable me to get onto a degree course for occupational therapy straight away. The first degree course I did was health sciences at Sunderland University, which really did open the scope and my understanding around health promotion, anatomy, physiology, health management, etc. So that was really, really worthwhile. I would say nothing is a wasted journey. There's reasons for everything and different paths to take. So in 2003 I qualified. I worked down south. I moved from the northeast down south, and I did a 6-month rotation, which means that you go into different settings at the NHS in the acute sector. So I worked with orthopaedics, stroke and rehab, general elderly, which we did home visits, equipment provision, supported discharges for people. And then I relocated after 6 months back to the northeast of England and joined a local authority in the northeast. And I worked there from 2004 right up until 2015. And in that time as an occupational therapist, I joined social care, which meant that we were able to look at the bigger picture with a person. So a person would be discharged from hospital and they would come and be supported by an occupational therapist in social care, and we would look at their home adaptations, what perhaps they needed at home to adapt their environment using all sorts of different techniques. Moving and handling, being involved in moving and handling, how we put slings onto people, how we're able to move them from one place safely to another after a period of injury or perhaps progressive onset of their condition. And we would look also at designing their homes with technical officers, designing plans, scoping out what extensions could look like for somebody that could no longer get upstairs. We may look at installing things such as stair lifts, vertical lifts, such an array of different interventions that you could use and support a person with to keep them in their own home. And that's the key thing about an occupational therapist in social care particularly, is that their home is where the heart is. Ultimately, we would endeavour wherever possible to enable a person to remain at home for as long as possible. In 2015, I then ventured onto a slightly different pathway in my career. I had been previously involved a lot with a fantastic specialist nurse at a regional specialist hospital nearby, who was a specialist in motor neuron disease. This gave me experience and the passion to want to be more involved and want to be more specialised in an area. So I went to work at James Cook University Hospital as a motor neuron disease community outreach practitioner. So it was a completely different role to an occupational therapist. I supported many people alongside a multidisciplinary team clinic, combining physiotherapists, speech and language therapists, specialist nurses, neurological consultants, dietitians, neuropsychologists, all to support people who were living with and had been diagnosed with motor neuron disease. It was an extremely rewarding job. I did this for 12 months. It was a real great experience. and I was able to utilise all of my occupational therapy skills into that, and learned masses of information around respiratory and disease management and how to support people living with terminally ill progressive conditions. In 2017, I joined North Yorkshire County Council, and I'm still here, and I am currently, like I mentioned, the acting principal OT, but prior to that I was the senior occupational therapist within a practice team, and our roles very much are around development of practice in wider social care initiatives and occupational therapy, how we promote the practice, how we can support the staff in North Yorkshire and wider to really reach the potential and benefit for our customers in the community. So it is a real diverse job role. I would say that the biggest misconception about the role of an occupational therapist is that it's potentially what people would say was an old-fashioned basket weaving job, where people would just look at doing activities or just fitting equipment and discharging them home to just be safe. It's much bigger than that. It's so rewarding. I would say one of the most challenging parts of the role, when asked, it would be learning to switch off and not taking too much home with you, and also managing lots of people's expectations and sometimes quite a varied and heavy caseload. But with that comes the reward of being able to really support a person and their families, and for whatever they're going through. You will see a massive diverse range of medical conditions, and you can learn so much in social care as an occupational therapist, which can then venture and take you on to wanting to go into specialisms. We do have a promotional video, which I'm sure you'll be able to see, on a day in the life of an occupational therapist with one of our OTs, Lucy Holden. And it will show you the autonomy, the freedom of an OT in social care, very community based, very hybrid working, office working and home working, real supportive teams and a real family in North Yorkshire of fantastic social care colleagues. The biggest piece of advice for an aspiring occupational therapist is believe that you can. Don't let anybody tell you otherwise. And if you've a wonderful caring and problem-solving nature for people and a desire to help them return to some form of normal for them, then go for it. It's really, really rewarding, and I think you will potentially open up many avenues for yourself to lead on to all sorts of different aspects of occupational therapy. Occupational therapists don't just sit in healthcare. They sit in social care, as we've just talked about, but also GP surgeries. Occupational therapists can work in the prison service, in mental health services to support people with mental health conditions, education in schools, in children's services. There are many, many different areas you can work in as an occupational therapist, and some real exciting opportunities coming up as we in 2022 now, and there's such scope. And I think one of the best things as an occupational therapist is linking in with all of the different professions that you can to pull and network everybody together for the benefit of the person. So if you think this job's for you, absolutely go for it. I would highly recommend it. I'm 19 years in, still loving it. I still have enthusiasm, still want to achieve the best for the people that we support. If you'd like any more further information, please do contact us at North Yorkshire, and we'd love to have you on board. Good luck. Bye.